Cancer Ghana unveiled Arts Unction Project. The program was organized to raise funds for the children living with childhood cancer. According to the director of Cure Childhood Cancer Ghana, Dr. Nihad Salifu, pediatric oncologist at Greater Accra Regional Hospital, in her engagement with the press said that their goal is to diagnose over 1,200 to 1,500 a year across Ghana. She calls on media bodies to support with the awareness creation in order to reduce the rate of children dying of early warning signs of childhood cancer in Ghana. She also calls for more collective support from general public to save a lot of children's lives in order for them to also contribute to national development.
Put together Cure Childhood Cancer Ghana, put together a fundraising activity. So we have been doing quite a lot of activities to raise funds for him. But we also fell on the artwork that he had been doing, just something he was casually doing on the ward and at home during the course of his treatment. And it turned out to be very beautiful artwork that many people admired. And due to the urgency of the need, we decided to auction some of the artwork to be able to raise funds to enable him to seek treatment as early as possible. So that is the essence of this fundraiser art auction that we did today. Thankfully, we have had a lot of support. People have shown up. They have given us some good bits, and we hope that the cash comes in quickly and then we are able to fly him out to get him treatment that will optimize his chances of cure. It's actually our very first art auction to raise funds for a child in need. If I'm not mistaken, this is the very first art auction mostly done by a child in the country to raise funds for that same child. If I'm not mistaken, that is what it is. So it's historic and it's phenomenal in a way that his art is very, very beautiful, as you can all attest. Let me say that childhood cancers are generally highly curable. If you take 10 childhood cancers, 8 out of 10 can be cured. So when a child with cancer is in need, it's really important that we put in our best resources to be able to cure the child. And when I say cure, it means that you can revert the child's lifespan to the normal life expectancy of the population. The cancer goes away, they get to grow, to become adults, and also contribute their quota to national development. And that is why it is really important that we commit resources to be able to treat children with cancer. And it is the primary reason why we have actually embarked on this journey, because we know and we are hopeful that when he gets the treatment on time, he will be cured. Estimates, we expect to diagnose between 1,200 to 1,500 new childhood cancer cases a year. Unfortunately, due to lack of awareness and many other factors, we are currently diagnosing about 500 a year across the country. So we really need a lot of input into awareness creation, which we are actively doing. And I'm so glad about the media presence here, because we actually need you to help us with awareness creation so that we can communicate properly the early warning signs of childhood cancer, which might look like many other diseases, including malaria or typhoid, as people would say it. So we really need to embark on these campaigns, and we need media support, intense media support, to be able to achieve this, because the cancers are occurring and children are dying out there for cancers that we could actually cure. So we actually need a lot of media campaign as far as childhood cancers are concerned. Government announced the inclusion of 4 childhood cancers onto the National Health Insurance Scheme. It was really welcome news to those of us in the pediatric cancer space. Unfortunately, the implementation has been quite poor, and so many parents are still paying out of pocket for treatment. And so even for those who don't require treatment abroad, parents are still struggling to pay for this. And we are hoping that steps will be taken immediately to revert what is going on now. People have been very benevolent since we started this fundraiser. Anicius is just one of many who need the support. There are many more children out there who need support. So even if eventually, and as I really hope that very soon he'll be out of the country to get treatment, people should still make it part of their routine to give off to support these children, because there are a lot more children. So we are still open. Cure Childhood Cancer.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.